Thanks, Minister. We have the question now from Albert. He says, how many of the 600 rooms needed to house recovering COVID-19 patients in isolations have you signed off on based on offers from the private sector?
Okay, so I'm looking at a report that I got just minutes before coming in, and we really have not signed off. Well, let me not say we have not, because we have a facility in Montego Bay which is about 50 rooms offered to us by a hotelier, which we are now retrofitting, which will suit the purposes that we are anticipating for the 600 room. We have offers that I'm looking at here, which would total a number of rooms, but again, it's quite fragmented, offering 10 or 15 rooms. There are many restrictions for health workers as opposed to persons who are positive and in transition. And of course, there are differences as it relates to the cost of these rooms. I wanted to go this route first, which is to invite persons to offer, given that economic activity is relatively limited, certainly in the tourism industry, and this could be an opportunity to continue some levels of operation and keep some workers engaged while we respond to the health challenge that we have. Beyond that, we will have to, if we do not find suitable facilities, we will have to identify what represents a suitable facility and engage those persons or institutions to use those facilities. As I said earlier, I was trying to be as diplomatic as possible. I'm not in the habit, or my philosophical approach or ideological approach is not to promote taking over private property without an agreement on all sides. But the reality of the situation is that this is a public health crisis, that we are all at risks, and we all have to find a way to contribute, if necessary, to solving that problem. Now, that's a roundabout way of answering the question. The answer to your question is we still have a fairly long way to go in identifying those 600 rooms. It's not just about the rooms, it's also about where they're located, because we want to place them strategically. So access, depending on where persons are, can be relatively easy, and that the management or manning of these facilities can also be efficient. So over the next few days, we'll be doing more to try and identify what is suitable, and we will have to engage in appropriate discussions with those persons to ensure that that is in place, because this is fundamental to the response plan that we have, particularly when we go into community spread, which we believe is going to happen sooner rather than later.
All right, thanks, Minister. We're going to go to David Casanova. You can go ahead with your question. And please just identify with Media House you represent.
David Casanova, Love Television. My question is, why can't persons be tested arbitrarily?
Okay. All right. A test at random, I'm assuming this means that you just want to know if you have COVID. It does not really give you a lot of information, because if it is that you are negative, if you have been exposed, you might be incubating the virus. And it gives you a false sense of security that you are COVID-free, when in fact 2 to 3 days later you may start developing symptoms and probably would have to be tested again to find out if this is COVID now. So it really is a matter of looking at resources that are available to ensure. I mean, we do expect that we're going to see a spike in the number of cases, and we want to ensure that the resources that we have will be able to take us through to test for the persons that are symptomatic. So at this point, the person's just walking in to find out if it is that they are positive. If they are positive and they are asymptomatic, it still means that they're going to have to stay at home. If they are positive and they're having mild symptoms, they still have to stay at home. If it is that they're negative, it does not mean that they don't have COVID. So if they think they have a contact, or if they think they have some kind of a symptom, they still have to stay at home. So our message really is that if it is that you have mild symptoms, then you should stay home. It may be COVID, so you need to stay home, protect yourself, protect your family, and stop the transmission. If it is that you do not have symptoms, but you think that you may have contacted somebody who may have had symptoms, then you need to stay home. If you develop symptoms, then if they're mild symptoms, you stay at home and you treat with medication for the fever, and we recommend that you use Panadol for that treatment. So the main message is really staying at home. Call the hotlines, and I'm encouraging persons. I know that there are some gaps that we need to fix where the hotlines are concerned, and we are working on that. But call the hotline so that at least we have you on a list, so that if it is that you are suggestive, highly suggestive of COVID, that we can be following you up on a daily basis. Or if it is that you are at a high risk or a vulnerable person based on any kind of immunocompromised situation, then we're able to follow you up to see if and when you do develop symptoms, if those symptoms become moderate to severe that you need hospitalization, then we can get you into a facility that you can be treated.
I just got some information just before your next question on the fit testing schedule. I think a question was asked by RJR's Dion Jackson Miller. Re-KPH and Victoria Jubilee. Thursday, the 26th of March, 100 to be done. 50-50 on either side of both hospitals. March 27th, 54 Bustamante Hospital for Children, 44 National Chest Hospital. And the information is that testing is ongoing, so more will happen and more have happened in the past. So the process continues as we prepare.
Thank you, Minister. We have a question on Twitter. I'm going to ask Dr. Webster to respond. The persons are asking about patient 1 and 2 and their status.
Thank you. Patients 1 and 2 are asymptomatic or they're without symptoms for a few days. There are 3 patients currently who are asymptomatic in the group, and their course was between 4 to 6 days, on average 5. And so they are asymptomatic, but for them to be discharged, they would have to show that their swabs are negative. So far, these persons are failing on their discharge swabs. So they are still shedding the virus and hence may transmit it to others. So this is why they are still in hospital.
All right, thank you, CMO. We're going to go to a follow-up from Michael Sharp. Michael, go ahead, please.
Yes, thank you. Just to let you know, sir, it's the hospitality workers, not the farm workers. But secondly, though, cutting down that curve, should we continue on the trajectory and good management, and congratulations and kudos to the team. However, if our neighbors and if our big neighbor is not cutting down their curve, does not that delay us from joining and getting back with normal life?
Thank you, Michael. You are right. Firstly, the prospects for recovery as it relates to Jamaica are heavily linked to what entails elsewhere in the world, and particularly what entails as it relates to our closest partners, both our economic partners, places where many of our relatives and friends reside. The reality is that we want to protect our population, and so we will do what is necessary, as we are now doing. But we are also part of an interconnected world, which means we are codependent on each other. And so to the extent that other countries, the United States, for example, which is our main trading partner, may have restrictions within their own country as they attempt to overcome this challenge, would also impact us as it relates to our resuming normal activity. I would say, however, that for us here, our obligation is to ensure that the public health threat that is now a challenge for us within our population and within our borders is our absolute priority. And what we want to do is to overcome that threat as quickly as possible, and so resume a sort of normal sense of feeling secure as Jamaicans within Jamaica. And if we do that and then have to wait on others, and that's a choice that we have not many options in so doing, but at least our own population will feel safe. And so our priority right now is the public health interest. And as you can see, it's an all of government approach. And we're doing what we can on the economic front to give support while we work to overcome this threat that is challenging our normal life here in Jamaica.
All right, thank you very much, Minister. I have another question. They're asking for persons who if they should be practicing social distancing at home, particularly if you are a younger person living with seniors and you may be coming off the road and back into the home. How should you practice social distancing at home? I'm going to ask Dr. Webster-Carr to respond.
Yes, thank you for that question. So we'd like to say physical distancing because our older persons, we have to socialize with them. But yes, if you're coming home from work, we would want you to make sure you wash your hands before you interact with your older relatives, or if you are a caregiver, and ensure that you ensure proper sanitation. And as if you are ill, then you do not interact with the older persons, and you get somebody else to look after them. So we would want you to pay special attention to your older relatives or persons who are in your care, and ensure that you do not go to work, do not interact with the older persons if you're ill, and decrease the amount of contact time with them. You can interact with them from a distance, however, to ensure that you are socializing with them, but not in their physical space.
All right, thanks very much, Dr. Webster-Carr. We have a follow-up from Dion. She said she spoke with the CEO of Andrews Hospital, who said they do not have the PPEs for their staff or ventilators, which is why they can't treat COVID patients. The minister on Monday had indicated that there would be some discussion. They're asking now for an update.
Okay, so just to say that that discussion has taken place. The permanent secretary had a lengthy conversation with the management of the institution. I've since subsequently spoken to him, got a brief, as well as to other critical stakeholders who are linked to the hospital. As you know, it's a church hospital. The Seventh-day Adventist Church owns and operates the facility. The end of that conversation, there was an agreement for a proposal to be submitted, which would included in that an explanation of some of the shortcomings of the institution, and we will take the necessary steps to discuss how we can get that hospital as a critical part of the response to the challenges we face. We really do need all hands on deck, and therefore we will do what we can to ensure that we get the hospital as part of the response infrastructure.
Right. I just want to say that in terms of critical care spaces, we would be concentrating on equipping the hospitals that would have the necessary facilities in place, because the high dependency space or intensive care space requires much more than the ventilator and the bed. It requires the staff to be in place as well as the facilities for laboratory support. So we have to ensure that, and what we are moving to do is to ensure that our hospitals that are equipped to provide this kind of intensive and high dependency care receive the necessary equipment to do that. And in that light, I want to just mention that we have received 3 additional ventilators this week, and within another 3 weeks, we are getting an additional 7, and then in early May, we're getting an additional 20. So those ventilators are slated for delivery at those times.
Thank you very much. We're about wrapping up in about 5 minutes or so. We'll take a couple more questions. So Damien Mitchell from the Gleaner is asking, is there anyone else from Cornpeace Clarendon who has piqued the interest of the health authorities? And he's also asking for Minister, is the government considering further restrictions on movement?
Well, all the persons within Cornpeace district who would have been contacts are being closely followed up at this present time by the Public Health Department. But in terms of development of symptoms, up to today, I have not been notified of any other person outside of the one person that was confirmed.
As it relates to the the possibility of more restrictions, it's a very fluid situation, and I think we've said that over and over. The response so far has been measured to the assessment of the risks and what we considered to be, at the time, needed to be done to minimize that risks, while at the same time managing our economic realities, and not just on a collective basis as a country, but as individuals, who many of whom have very short earning cycles, limited disposable income, and therefore if they don't work, it becomes very difficult for them. And of course, industry that has to respond to the needs or the basic needs across the country. So we've had to balance those critical variables. Having said that, the Prime Minister and the Cabinet are very clear in their minds, and as a participant of those conversations, we're very clear that if we have to make other decisions that are more stringent, that are more restrictive, then those decisions are going to have to be made. One of the ways to manage the extent of those restrictions under law is the extent to which the public understands and appreciates the severity of the challenge and the need for personal responsibility to take the necessary precautions to protect themselves, their families, their communities, and by extension, the country. And while we believe that many Jamaicans are very seized with the importance of doing this, we are concerned, frankly speaking, that there are some Jamaicans who who are still not observing the social distancing, the need to stay at home, minimize the sort of public gatherings. And if that observation becomes the norm rather than the exception, and the risks for community spread becomes greater or becomes a reality, then I believe that the Prime Minister, who is on record of saying so, and the Cabinet would have no difficulty in increasing the restrictions. And I do believe that that could be a possibility going in the future, but again, it would be subject to an assessment. I should add that this digital press briefing that we're having here, which I'm told is probably the first in Jamaica, has, as it relates to numbers in the room, exactly 10 persons. Okay? 10 of us in the room at the ministry. So we're actually complying with the 10 maximum congregation. It might be a minor point, but nevertheless I make it for whatever it's worth, because we really want to lead by example. And if you notice, we have three of us at this table. And I'm stretching out to try and touch the chief medical officer or the epidemiologist. And it's impossible because we're trying to do the same as it relates to social distancing. I know it's a difficult task. We are, let me be frank and parochial, we are a touchy-feely population. We like to enjoy ourselves. We like to mingle and mix. But the realities of this virus is that we need to avoid that. And I really want to appeal to the population. It is a lot more serious than some of us take it. You only need to go on network TV to see what's happening in places like New York. Worse, to see what's happening in Italy and other parts of Europe. We really do not want that to happen to us here in Jamaica, because a lot of us will be left crying and regretful. So let's try to practice prevention, even while we prepare to deal with the cure.
Well, thanks, Minister. We're going to take our final questions now. We have a question from Emma Lewis. Emma, you can go ahead with the question.
Okay, I think this has been partially answered, but I want to know how many ventilators in total are we expecting to have, say, in the next 2 or 3 weeks on the island?
In the next 2 or 3 weeks, it would be about 10, and then early May we're expecting an additional 20.
Final question from Shanik Dawkins. He says there's an ad in the Sunday paper with the Ministry of Health and Wellness seeking to engage retired nurses and retired health educators in response to the coronavirus. How does the ministry plan on engaging these retired professionals when some of them would be at the increased risk due to their age?
I didn't get that. Can you repeat that question? Sorry.
Sure. An ad in the Sunday paper by the Ministry of Health and Wellness seeking to engage retired nurses and retired health educators in the response to the coronavirus. How does the ministry plan on engaging these retired professionals when some of them would be at an increased risk due to their age?
Okay.
What?
You
wanna go ahead?
Okay. Right. So we are certainly aware of the risk that are faced by some of our persons that work as healthcare providers. In terms of the retired persons, they not only bring their clinical skills, but they also bring their administrative skills and their wide areas of experience. Many of them would have experience in public health. So we don't expect that persons are necessarily going to be clinically engaged, but we expect that certainly in administration and in supervision, which is really, really needed at this time, that we can utilize some of these persons, which would allow the younger persons to be able to be more clinically used.
All right. Thank you very much. I'm going to ask the minister just to give us closing remarks.
Thank you very much, Stephen, and thank to all those who are online. Thanks to the production team here, and of course to the clinical team, both at the table and otherwise. Ladies and gentlemen, I want to thank you for listening, and to the media, my media colleagues, for sharing the information that you would have received. This is part of our ongoing update. Our commitment is to be as transparent as possible with information around this issue, because we are convinced that it is in understanding the threat and the challenges and what you must do to protect yourself that we will overcome this issue as quickly as possible. The regular media briefs will continue, and we will use this based on the feedback as part of that information flow. If we do not have a live brief, then we will send out once a day an updated release, if you will, or a briefing to indicate exactly what has transpired over the previous 24 hours. And we will do this until we feel we have a handle on the situation, and the public's need to know on a daily basis is not as important as it is now. Thank you very much. Let's continue to do what we have to do. Remember social distancing. Remember to look out for your brothers and sisters and friends. And let us work together to overcome COVID-19. Thank you.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.